Did you know that early detection could make all the difference in fighting cancer? Every year, millions overlook subtle warning signs, delaying diagnosis and treatment. Recognizing these early signs might just save your life or the life of someone you love. Today, we're uncovering 12 early cancer signs it could save you. From unusual lumps to changes in your skin, these subtle symptoms are your body's way of signaling a problem. Early awareness can mean the difference between a simple treatment plan and a much harder battle. Cancer can be deceptive. Its early symptoms often mimic harmless conditions, leading many to ignore them. Unfortunately, by the time these signs are taken seriously, the disease may have already progressed. That's why understanding these warning signs is vital, not just for you but for those you care about. Let's dive into cancer signs you should be watching for. Let's dive deeper into each early warning sign of cancer, breaking them down one by one. We'll explore why these symptoms occur, how to identify them, and when to act. First, let's talk about changes in your skin. Your skin often serves as a window into your overall health. Keep an eye on moles, freckles, or spots that seem to change over time. A mole that becomes larger, darker, or irregular in shape could indicate melanoma, a serious form of skin cancer. But here's the catch, it's not just moles. Skin that thickens, darkens, or feels scaly might signal other types of cancers. It's vital to use the ABCDE method for moles. Asymmetry, border irregularity, color variation, diameter larger than 6 mm, and evolution. If any of these apply, it's time to consult a dermatologist. Next, consider unexplained weight loss. Imagine dropping 10 pounds without even trying. While that might sound appealing, unexplained weight loss can be a symptom of cancers like those affecting the pancreas, esophagus, or lungs. Why does this happen? Cancer cells can steal nutrients from your body, speeding up metabolism and causing weight to drop rapidly. If you notice significant weight loss and there's no obvious cause, like a diet or workout routine, this is worth investigating with your doctor. Fatigue that won't go away is another red flag. We're not talking about the kind of tiredness that comes after a long day. Cancer-related fatigue is profound and unrelenting. Blood cancers, such as leukemia, can affect your red blood cells, leading to anemia and energy depletion. Likewise, advanced stages of cancer can drain your body's resources. If you find yourself tired despite proper rest, hydration, and nutrition, it's time to listen to your body and seek medical advice. Unusual lumps or swelling should always be taken seriously. These could show up anywhere, under your skin, in your breast, neck, armpits, or even groin. Some lumps are benign, but others may indicate cancers like lymphoma or breast cancer. What's important to note is that cancerous lumps are often hard, immovable, and painless. Don't wait for them to hurt before acting. Early detection through self-checks and routine exams is key. Bowel habit changes might not seem alarming, but they are critical indicators. For them to hurt before acting. Early detection through self-checks and routine exams is key. You might also notice blood mixed with your stool or an urgent, frequent need to use the bathroom without much output. These changes occur because tumors can partially block or irritate the colon. Keep track of any significant alterations and consult a doctor if they persist for more than a few days. Persistent coughing or hoarseness can signal lung or throat cancer. It's easy to dismiss a cough as a lingering cold or seasonal allergies, but a cough that lasts over 3 weeks, especially if it produces blood or is paired with chest pain, requires immediate attention. Hoarseness, too, can be linked to cancers of the voice box or thyroid. Early imaging and testing can provide answers and peace of mind. Trouble swallowing or persistent indigestion is another symptom often overlooked. These issues can indicate esophageal or stomach cancer. Cancerous growths can narrow your esophagus, making it feel like food is stuck. Indigestion might be chronic and not relieved by typical remedies like antacids. It's worth noting that these symptoms are sometimes subtle, which makes regular checkups even more essential. Unexplained bleeding is one of the more alarming signs but also one of the clearest. Blood appearing where it shouldn't, whether in your urine, stool, or saliva, can be a symptom of bladder, colon, or lung cancer. Even spotting between menstrual cycles or post-menopause in women warrants a visit to the doctor. Bleeding occurs because cancer can damage surrounding tissues or blood vessels. Pay close attention to your body and take action if you see signs of blood. Chronic pain without explanation could be your body's way of signaling a deeper issue. Pain is the body's natural alarm system, but when it becomes persistent and unrelenting, it's crucial to dig deeper. Chronic pain, especially in areas like the back, abdomen, or bones, might indicate that something is amiss beneath the surface. This type of pain is often associated with tumors pressing against nerves, organs, or blood vessels. For instance, pancreatic cancer is notorious for causing dull, persistent pain in the upper abdomen that can radiate to the back. Similarly, bone pain might be linked to cancers that originate in or spread to the bones, such as multiple myeloma or metastatic breast cancer. The pain might feel worse at night or during rest, which is a distinct characteristic to watch for. It's easy to brush off these aches as a part of aging, overuse, or even stress, but if the pain is consistent and unexplained, it's time to act. Chronic pain doesn't always come with other symptoms, making it even more important to consult a doctor if it persists for weeks without a clear cause. Sores that don't heal are another symptom to watch for. Your body is designed to heal itself, so when a sore lingers, it's often a sign that something isn't functioning as it should. Whether the sore appears on the skin, inside the mouth, or elsewhere, prolonged healing could point to a deeper issue, such as cancer. Skin cancers like basal cell carcinoma often present as non-healing sores or lesions, especially on areas exposed to the sun. These sores might bleed, crust, or ooze without fully recovering. Oral cancers, on the other hand, commonly manifest as painful or painless ulcers inside the mouth or on the tongue that don't resolve. Smoking, chewing tobacco, or heavy alcohol use can dramatically increase the risk of these types of cancers. People often dismiss such sores as minor irritations caused by biting the inside of the mouth or poorly fitting dental appliances. However, if you notice a sore persisting for more than 2 weeks, it's vital to consult a healthcare professional. Recurring fevers or infections are often dismissed as harmless. Fevers are your body's natural response to infections, but what happens when they become frequent without a clear explanation? Blood cancers like leukemia, lymphoma, or myeloma often suppress the immune system, making you more vulnerable to recurring fevers and infections. These fevers might not come with typical cold or flu symptoms and may occur alongside night sweats or chills. In some cases, repeated infections, like bronchitis, urinary tract infections, or skin infections, can also be a sign of an immune system that's struggling to fight back. Cancer cells, particularly those affecting the bone marrow, can disrupt the production of healthy blood cells, weakening the body's defenses. While a single fever might not be a cause for concern, recurring fevers over weeks or months warrant a deeper investigation. Lastly, changes in the breast, in both women and men, are a critical warning. Breast cancer is often thought of as a disease that primarily affects women, but men aren't immune. Changes in the breast area, whether dimpling, redness, or unusual swelling, can be an early sign of breast cancer. For women, nipple discharge that isn't related to breastfeeding, especially if it's bloody or occurs spontaneously, is a major red flag. In men, a lump under the nipple or in the breast tissue is one of the most common signs of male breast cancer. While these symptoms don't always come with pain, they shouldn't be ignored. Regular self-exams are a powerful tool for detecting abnormalities early. Pay close attention to the texture and appearance of the breast area, and if something feels or looks unusual, consult a doctor immediately. As we've seen, these signs might seem unrelated or insignificant on their own, but together, they can paint a picture that's too important to ignore. Your body is constantly sending you signals. It's up to you to recognize and act on them. One story stands out. A young woman noticed a small, painless lump in her breast but ignored it for months. When she finally saw her doctor, she was diagnosed with early-stage breast cancer. Thanks to her eventual action, she received treatment in time and is now thriving. This shows the power of recognizing and acting on early signs. From unexplained weight loss to changes in your skin or bowel habits, these 14 signs are your body's way of calling for help. Paying attention could make the difference between catching cancer early or letting it go unnoticed. If you learned something valuable today, share this video with friends and family to spread awareness. Leave a comment below if you've experienced any of these signs or have advice to share. Don't forget to like and subscribe to Nutritionnomics for more health-saving insights.